Hi, this is Dr. Douglas Harrington, and we're here at the shops at Chino Hills, and we're running an event today to test people for the COVID-19 antibody test, which is extremely important from a public health perspective to identify the true prevalence of the disease. And interestingly, in the last couple of weeks, we've heard of significant progress on vaccines. There are 4 different vaccine strategies being employed. One of them uses the whole virus. Others use the proteins on the virus. Some use information from the genetic material of the virus. And others are creating artificial viruses attached to proteins that educate your cells. So I think that by the first quarter of this year, we should see significant progress and may actually have one of those antiviral vaccines released. Pfizer recently announced a 90% success rate in developing antibodies from their experimental vaccine. So the main message that I want to give to everybody is, number one, people aren't dying. The actual survival rate, if you're less than 69 years, is 99.97%. If you're 30 and under, it's 99.99%. Now you have to be careful if you're over 69, but right now we don't have a lot of people being admitted to the hospital. We have learned to take care of people who do get sick. Now, one of the complications of COVID-19 is cardiac manifestations. And I do want to let you know that we're even learning how to handle those. The virus itself likes to attack the lining of your arteries. And we've learned how to treat that with some old drugs that were used for things like arthritis and for inflammation. So the good news is we don't want you to be afraid. We want you to be vigilant. We don't want you to not be cautious. But you don't need to live in fear, you just need to follow the rules. And I'm going to stress again something that I've stressed before, which is be careful of the bathroom. We're able to track outbreaks in sewage, and that allows us to go into an area and know that there's an outbreak pending there. But keep in mind that toilets can fling droplets up to 20 feet away, and therefore when you go into a bathroom you should keep your mask on. If there's a lid, close the lid and wash your hands copiously afterwards, or use hand sanitizer. We have an event going on here sponsored by the GUARDaHEART Foundation, which is a 501c3 not-for-profit, and it's no cost, meaning that it's all covered under the CARES Act. Even if you have no insurance, want to stress to you that the only reporting we're required to do is to the health department. We're not required to give information to ICE or any of these other organizations. And we don't want you to not get tested, because this test helps our public health authorities, number one, know how prevalent the disease is. That means how many people are actually infected, because most people that get this have no symptoms, 40 to 60%. So we really need to know what the true prevalence is so we can determine how dangerous the virus is and where best to focus. If we see a high level of antibodies in a community, we know that we need to go in there and foster some preventive measures and stimulate those people to be more careful. And so in general, I want you to know that we're going to be at the shops at Chino Hills today, Wednesday, and Thursday from 9 to 4. And we do take walk-ins. You can register online at www.GUARDaHEART.org. That's GUARDaHEART.org. And we look forward to seeing you here. Okay, thank you.